Now, there actually aren't any slides for this particular presentation, so you actually get to see all of me. We'll see how that goes. Um, we're going to start by talking about the bleeding that you have after your baby comes out. What happens is after the baby is born, the uterus is going to start to shrink down, and where that placenta was attached, the placenta has now come away, and that's actually an open wound now that will need to heal. And the bleeding that you have won't be just blood as a result of that. It will be blood, it will be tissue, it will be mucus, it will be amniotic fluid, it'll be vernix, it'll be anything baby left behind as they exited the building. And the bleeding for the first couple of days, particularly if you're breastfeeding, will be quite heavy. So we want to make sure that you're not soaking the pad and having to change that pad more than once an hour. If you have to change the pad more than once an hour, that's too much bleeding and you need to let your care provider know. Now, in the beginning, while you're in hospital, the staff will be looking after you and making sure that your bleeding is under control. When you get home, that's now on you, and you need to make sure that, again, you're not having to change that pad more than once an hour. If you are, that's too much bleeding. Now, over the course of the first few days, it will be quite heavy, and then it will slowly start to taper off. So usually, if you're exclusively breastfeeding, that bleeding and discharge could last upwards of 2 weeks. And usually by the end of that second week, we're really just talking about discharge. You're probably in panty liner world at that point. If you are not breastfeeding at all, that bleeding and discharge could last upwards of 6 weeks. So breastfeeding, chest feeding is going to get that uterus back to its pre-pregnancy state and heal it faster. If you're doing some combination of feeding and or formula and breast milk, then it could be somewhere in the middle. It'll also depend on how fast you heal. So we all heal differently. And if you're taking your recovery seriously and resting and doing what's needed to be done to heal faster, then again, you'll heal faster. Now, I generally don't recommend, or what I do recommend is actually the long, thick, horrible overnight pads. They're long, they're thick, they have wings. We hate them. I get it. However, I recommend those because those little thin, always infinity ones, this bleeding that you're having is just going to laugh at those and go, ha ha ha, change your sheets. But what I also don't want to recommend either is the always with the dry weave surface on it, that plasticky dry weave surface. That chemical based surface with the amount of bleeding that's coming out of you can actually break down and cause a chemical burn to your perineum. And you get enough going on down there without having to deal with that. So I usually recommend a Kotex or Stay Free or something with a more natural fiber surface that isn't going to cause any sort of issues. Now, some people will recommend using like Depends undergarments or incontinence underwear, and you can totally do that. But what I recommend is, at least for the first few days, you actually use the pad as well. And the reason is that we have guidelines for too much bleeding based on the pad. We don't have it based on the underwear. And the underwear can potentially hold more than the pad. So you could possibly be bleeding more based on what's coming out of you and how often you have to change the pad. So what I recommend is, if you wanted to use the underwear, no problem, but use it as a backup for the pad, at least for the first few days, 2, 3, 4 days, while the bleeding is quite heavy. The other reason I don't recommend it for the first few days is because they are designed to absorb urine. And what's coming out of you is significantly different viscosity than urine. It's thicker, which means it might not absorb as fast as you'd like. So that means that it could migrate places that you might not like it to go. And it might make you not feel quite all that happy down there. So using a pad with the underwear as a backup, at least for the first 2, 3, 4 days while the bleeding is quite heavy. And then as it starts to taper off, you can nix the pad. Um, let's see. The Down there, you could also be having some clots. Not uncommon for second birthing parents to have larger clots. First time parents could have clots of a smaller nature. Not often that you have larger clots for a first time birthing parent. But I definitely recommend that if you do have a clot, if it's bigger than a golf ball, if you have more than one or have to push it out, you absolutely have to talk to your care provider. Um, you could have some swelling down there as well, and potentially some stitches. So if you've had a vaginal birth, you could have some swelling down there. You can use, so when you're in hospital, they're going to give you an ice pack down there and it's going to feel really good. Yay. But what do you do when you get home? Your partner probably doesn't want you to use the same ice pack that they use on their tennis elbow or their hockey knee. What you can do, my big bag of tricks over here, what you can do is those pads that you're going to be using, you take the pad, and so it's usually wrapped up, and then you just open it up, leave the plastic backing on, and you can put water and a substance called witch hazel, WITCHHAZEL, witch hazel, combo, 50-50 combo of that until it's damp, not soaking, but damp. And then fold it back up, pop them in, make about 10 of them, put them into a Ziploc bag, pop them in the freezer, and now you have some disposable pads that you can throw away after you've used them. For the frozen pads, what I would recommend is you use them 2-3 times a day in the very beginning. The freezing will help, the cold will help with the swelling down there. The witch hazel will also help with the swelling down there. And the witch hazel will also help with any hemorrhoids that you might have, which I'll talk about in a second. But you don't want to have the ice pack down there for longer than 10-15 minutes, okay? After about 10-15 minutes, throw it away. And the reason is because to get the swelling down, when we put ice on it, the blood kind of moves away from that area. But we need blood in that area to actually heal it. So 10-15 minutes on and then toss it. And what you can do as well is, again, if you're using that Depends underwear, put the cold pad in there, and that's going to prevent any melting, leaking, things like that. Or when you get into the hospital in the labor and delivery room, oftentimes there'll be cupboards there that, will have Kleenexes and pads and whatnot that you can use. If you see any of the blue pads, these blue large square pads, bring some of those home. You can sit on those as well, which will make sure that you're not melting into your furniture or bleeding into your bed. But if you're so inclined as to not steal from the hospital, in the same aisle where you would get the witch hazel and the Depends undergarments, they sell sort of disposable bed pads that in the hospital, they're blue. In Shoppers Drug Mart, they're kind of a light green color. So bring some of those home, sit on those, ice pack down there, make it feel a little bit better, and then toss them. You probably don't have to do it more than 2 or 3 days if you have to do it at all. If you don't feel like you need to do it, then don't do it. But it can be very comforting down there if you've got lots of swelling and stitches. Let's see what else we got here. Hemorrhoids. So let's get back to hemorrhoids. So sometimes you will get hemorrhoids just from being pregnant, but pushing can also bring hemorrhoids on. What the care provider, when you're in hospital, they will look and see and make sure that they're not too bad. If they are quite bad, then the care providers will often give you a cream or like a medication to help deal with it. Though when small ones generally will deal with themselves and heal themselves. But you may want to have, when you get home, some hemorrhoid cream like Anusol or Preparation H, or some Tux pads, just to have in your postpartum kit, just in case yours are not bad enough for medication, but still a little uncomfortable. Let's see. They will give you medication when you're at the hospital as well. So for a vaginal birth, you will usually get Tylenol and ibuprofen and a stool softener. And these are usually regular strength Tylenol and ibuprofen. You'll take them, it's self-medication, so they'll actually just give you all the medication that you will need, and you'll take them as directed. And just take it, because even if you feel okay, generally speaking, the discomfort of sort of birth can happen maybe a few days later. So the muscle soreness of your entire body, all of that can usually happen in a few days. So just make sure that you're keeping on top of the medication and just keep taking it until it's done. Sometimes people will feel, oh, I feel really good. I don't need to take my medication. Well, okay, you feel good because you're taking the medication. And when you go off it and then you don't feel good anymore, then it's going to take you a bit of time to get back on top of it. So just take it until it's finished. And any medication they give you is not contraindicated for breastfeeding. So you can absolutely breastfeed with this stuff. Um, let's see. The stool softener that they give you, you will definitely want to take that as well, especially for a vaginal birth, because the last time you used the muscles to poop, you got a baby. So using them to actually poop this time might be a little bit disconcerting. Might not want to do it, but it has to be done. I've actually had a few clients constipate themselves upwards of 2 weeks for fear of having that bowel movement. Everything down there just feels so tender and close, and you feel like if you poop, you're going to rip any stitches you have. You're not. They're two different geographical locations, but they do feel really close together. So it can be very uncomfortable down there. So make sure that you are taking the stool softeners, staying really well hydrated, eating a good healthy diet, and that will help keep everything going and moving the way it's supposed to. For a cesarean birth, they will give you usually something more impressive, extra strength Tylenol, not that impressive, but extra strength Tylenol, and oftentimes a more advanced ibuprofen like naproxen. So these are going to be helpful again for not only just general body aches, but also the surgical pain you might be feeling. Again, you will also have a stool softener as well, because oftentimes some of the medication they give you will be constipating. So you want to make sure that you're actually taking that as well so that you don't get constipated. While you're down there as well in the bathroom, they will also give you a peri bottle. And what the peri bottle does is, and you can buy these, they're going to give you one for free. This is your gift with purchase for having a baby. And you can certainly buy ones that have like curved ends and things like that. But really all we're looking for is, something with some holes in the top there. You're going to fill it with warm water before you sit down to go to the bathroom. Once you sit down to go to the bathroom, you're going to spray that area with all the nice warm fluid, warm water, to clean that area, and also to maybe what do you say, dilute the urine so it doesn't hit your stitches. Highly concentrated urine on your stitches can feel a little bit uncomfortable. But that will be very helpful for cleaning that area up down there and then just patting to dry, especially if you have any stitches. Let's see what else we got. Fever. If you are experiencing any fever, anything over 38 degrees Celsius needs to be looked at. Now, of course, during this time, we would be concerned about COVID. So we want to make sure that you're paying attention to that. However, whether it's COVID or not, we are concerned about fever afterwards. That's an infection, and then you could have an infection anywhere in your stitches. If you've had a tear in your perineum, if you've had a cesarean birth, it could be in your abdomen. It could be in your uterus. It could be in your breasts. We don't know. So if you are experiencing a fever, you need to make sure that you're contacting your care provider as soon as possible. And I would suggest for a fever and infection, that would again be your OB. For bleeding and whatnot, OB. Um, let's see. If you have difficulty urinating, so if you've seen the first session that we had on anatomy and physiology, you saw that the bladder is really close to where baby is coming out. And sometimes the bladder can get a bit of a beating as baby passes by. So if you have difficulty urinating, if you feel like you have a UTI coming on or a urinary tract infection, if you feel like you can't empty your bladder properly, you need to make sure you're contacting your care provider. And in the case of a UTI or a urinary tract infection, if you can't get in to see your OB, you absolutely can go in to your family doctor for that. UTIs can go bad fast, so it's important to make sure that you are getting that dealt with right away. Let's see. You'll probably look about 5 months pregnant when you leave the hospital. So unfortunately, you're not going to go back to your skinny jeans right away. The uterus is going to need some time to heal. So through breastfeeding and, over time, the uterus will get back to its pre-pregnancy state, but it's going to take probably about 6 to 8 weeks. So when you leave the hospital, just comfortable clothes to go home in, track pants, big dress, nothing that's going to put any pressure onto your abdomen. If you want to eventually use belly binders or support garments and whatnot, you absolutely can. I would just suggest if you have a cesarean birth that you talk to your care provider first about when the best time to do that is. Swelling of the feet. So your feet may be getting more swollen as you get close to the end of your pregnancy. However, it's not going to get better after baby comes. Unfortunately, your swelling in your feet will get just a little bit worse before it gets better. So make sure that you are staying well hydrated, especially if you've had a very medicalized birth with lots of IV fluids. If you are putting good new fluids in, that'll push the old fluids out. So staying well hydrated is helpful. Keeping your feet elevated is helpful. And also your partner, your support person can also sort of do some massage up your foot, up past your ankle to sort of push that fluid back into your system. Um, Hair, you might have really nice hair as you get close to the end of your pregnancy. All the hormones and whatnot are causing your hair to be thicker and nicer if that's happening to you. It will all fall out eventually, and sometimes it can come out in clumps, handfuls of hair in the shower. You'll need to make sure that you're checking your drain. But that could take a couple of weeks of just your hair trying to get back to where it was before as your hormones start to rebalance themselves. Usually starts around 2-3 months, especially if breastfeeding is happening. So if it's happening, you're fine. There's nothing wrong, but it can be a bit disconcerting if you didn't expect it. All right. Anything else about your postpartum recovery? Oh, yes. So, what I would recommend is it's going to take about 6 to 8 weeks to heal everything in that area. So, we basically don't want to be putting anything in there in your vagina after a baby has come out of it. Okay. So, if you've had a vaginal birth, especially, we want to wait for anything like tampons, penises, um, anything else going in there, wait until your 6-week appointment with your care provider. Sex with your partner doesn't have to be just intercourse. There's more to it than that. So there's other things that can happen in the meantime. And then when you get the all clear from your care provider, you do you. All right. Or don't. It's up to you. Okay. Now we're going to talk about that was your physical recovery. We're going to talk about your emotional recovery now. So the placenta, now that that's gone, that was a giant hormone factory and it's now gone. And now your hormones are going to go, ooh, crash. So we used to call that sort of first part of the postpartum we used to call it the baby blues. So that first initial period, we used to call it the baby blues, but it's actually been reclassified now as normal postpartum adjustment because it's a normal postpartum adjustment. So it generally affects 50 to 80% of birthing parents and can happen anywhere around day 2, day 3, day 4. And it usually coincides with your mature milk coming in. So that day that your mature milk is going to come in, it's a bad day. It's like a big explosion of hormones. And it can look like crying, feeling sad, feeling frustrated, feeling tired, difficulty concentrating, probably because you're so tired, difficulty sleeping, even though you're so tired. And it usually lasts a couple of weeks, 1 to 2 weeks, and then you start to feel a little bit better towards the end of that second week. Good food, good rest, good support. This is going to be helpful to make that an easier transition out. Now, if it's not lasting, going longer than 2 weeks, We could be talking about postpartum depression. 10 to 15% of birthing parents will experience postpartum depression that we know of. I do suspect actually the number is higher. Um, and that's generally because it can come out anytime in the first year after birth and can actually be misdiagnosed as postpartum. And also now that we're getting into sort of this COVID area and dealing with, isolation and not being able to see our families and things like that, I think we're starting to see rises in postpartum mood disorders. Now, postpartum depression looks like sort of that normal postpartum adjustment, but exaggerated. So it's not just crying, but crying and irritability, not just being tired, but being physically and emotionally exhausted, changes in your appetite, feelings of doubt about parenting. Now, you may all have that. It doesn't mean you're going to have a few more check boxes. Guilt, absolutely. You could feel guilty. It's like the placenta comes out, and instead of a instruction manual, a giant dose of guilt comes out with it. And new parents are, especially new birthing parents, are sort of the punching bags of the world these days. The media, social media, strangers on the street, aunties, grandmas, everybody loves to sort of dump on new parents as you're not doing it right. Well, I think that's dumb. If you're going into this with love and you're doing the very best you can, you're good. Okay. So try not to let social media, especially, change your brain and how you're actually going to, appreciate your birth and the postpartum period. Feeling overwhelmed, that can absolutely happen. You may not have thought about all of this and what's going to happen. That's why I really encourage you to plan for your postpartum ahead of time as opposed to on the fly. Let's see what's going to happen. Um, oh, this is one of my favorite ones. Having no feelings for your baby. You may not like this little creature when they first come out, and that's okay. If you do not instantly fall in love with your baby, you're not a monster. There's a meme that goes around that says, "Oh, having a baby is like falling in love on a first date." La la la. Not for everybody. If you are not instantly in love with your baby, there's nothing wrong with you. You just may need a few more dates to actually get to know this little creature, to actually have a connection with them. But it's one of the reasons why I really encourage lots of skin to skin after baby is born, because that will help nurture that bond. But if it's going to take you a little bit of time, that's okay, right? You don't have to instantly fall in love with your baby. And loss of interest in usual activities. This is a big one as well. It's a giant red flag for things that of depression. So if you are socially isolating yourself, so for partners especially, you're going to be the one that notices this. If you're noticing that the birthing parent is socially isolating themselves, not going on social media like they used to, not talking to their friends like they used to, not getting back into the things that they were doing pre-pregnancy. These are sort of big warning signs. So if that's happening, make sure that you are talking to somebody, and you would be talking to your family care provider to start. So good food, good rest, good support, that's going to be helpful. But in the case of postpartum depression, we're likely talking about medication, potentially medication, but most definitely talk therapy. Okay. I encourage talk therapy for anybody. It's a good thing. But any medication that they give you is not contraindicated for breastfeeding again. So you can definitely breastfeed with the any SSRIs or antidepressant medication. Let's see. Now, the good news is that unless left undiagnosed for a long period of time, those with postpartum depression very rarely harm themselves or their babies. However, if the one that we're really worried about would be what we call postpartum psychosis. Now, in postpartum psychosis, where it's rare, 1 to 2 per 1,000 births, but it usually comes out around day 3, day 6, again, coinciding with your mature milk coming in. And it looks like hallucinations, paranoia, difficulty sleeping, strange behavior. If any of this is happening, especially for the non-birthing parent, you need to get the birthing parent some immediate emergency medical treatment. We're talking about definitely medication, definitely talk therapy, and probably a stay in the hospital for a few days while they try and figure things out. Okay. So it's important to make sure that you are getting that help and support as soon as possible. Right. Now, there are risk factors. So if you have any of these risk factors, it's important to make sure that you talk to somebody as soon as possible, even beforehand, so that you're prepared. So a previous postpartum mood disorder, odds are you're a first time birthing parent. So if that's the case, then that doesn't apply to you. A severe history of PMS. So if you were, not all that great, sort of emotionally prior to getting pregnant, you are at greater risk. Previous miscarriage or infertility. If it took you a long time to get to this point, you are at greater risk for a postpartum mood disorder. And if there's been years of fertility treatment or multiple miscarriages, again, you are at greater risk. Depression or anxiety during pregnancy. So you could actually get this stuff prenatally. And if you are, again, it's more likely that you will have it postnatally as well. A previous mental health issue. So any issues with anxiety or depression, any bouts of that prior to getting pregnant, you are at greater risk. A family history of postpartum mood disorder or mental health issue. So when I was diagnosed with a postpartum mood disorder with my daughter, so I have 3 children, so with my third child, um, it was finally discussed that my father suffered from depression. I thought he was just a jerk all these years. Turns out that's actually how he manifested his depression, was through explosive anger. So it didn't occur to me that that was depression, because that isn't the way I imagined that depression would manifest itself. But we also never talked about it. So it's important that you are talking about it. It's unfortunate that there are stigmas to having depression. It's something that we all have. And in this day and age, how could you not be experiencing some type of mental health issues with everything that's going on? So if you are, it's important to make sure that you are getting help right away. And I would recommend, again, talking to your family care provider first and talking to them as soon as possible. And the reason is because, especially nowadays, we are seeing a greater increase in postpartum mood disorders, but um, it's going to be harder to get the help that you need as fast as you need it, because there are wait lists. So some family doctors will actually do support with you, but some will refer you out. And if they are referring you out, again, there's usually wait lists. So make sure that you're getting this help and support as soon as you think you need it. All right. An unexpected or disappointing birth experience. I hope that through this, I've sort of, maybe laid down for you that the importance of being involved in the birthing process. Birth can't just run you over like a Mack truck and you be okay with it. You actually have to be involved in the birthing process. Ask those questions, be an active participant in your birth, so that this is where it's going to come back and haunt you. Okay. It's not only going to affect your physical recovery, but it will also affect your emotional recovery. So ask those questions, be involved in the process, and do everything you can to be an active participant. High expectations of birth or motherhood. So you may have this vision of walking down the street, pushing your stroller with your baby in it, looking all amazing, and meeting your friends for coffee, and yay, maternity leave is great. You'll get there, but it may not happen right away. So make sure that you are kind to yourself. Whatever expectations you have, just kind of lower them down a little bit. Um, it's important to make sure that you have realistic expectations about what your postpartum is going to look like. Okay. You probably don't have a staff of 50 looking after you. And if you do, I mean, that's amazing. But if you're a mere mortal like the rest of us, it's going to be a recovery. Something amazing and miraculous just happened to you. A human exited your body. So you are going to need some time to rest and recover from that. And when you are out in the world with your baby, maybe we'll be able to get back out in the world again. If you are out in the world with your baby and you're generally clean and your hair's in a ponytail and you have a swipe of mascara on, that's a win. Okay. So again, you'll get to where you want to be, but it's going to take a little bit of time. Okay. So be kind to yourself. A baby with special needs is going to cause some issues and potentially sort of up your risk for postpartum mood disorder. A fussy baby, colic, things like that. A tendency to worry. Is that you? Difficulty asking for help. Is that you? Stressful life events. Please try not to move immediately before or immediately after your baby is due. That's basically two of life's major stressors jammed both together. But sometimes we have issues with moving, loss of jobs, things like this. Um, those are sort of a perfect storm for a postpartum mood disorder. Lack of help or support. And this is again why I think we are seeing in the age of COVID that we are seeing more cases of postpartum mood disorders, because we don't necessarily have the ability for our family to come over and help and support us from where they are. We don't often live with our villages anymore, so having people come and help you out, that's not always the easiest thing to do now. So I do encourage you, I mean, at minimum, having some virtual postpartum support, or having somebody come in and help you through postpartum support, like a postpartum doula. Um, Another risk factor, abrupt weaning. So yeah, not doing this breastfeeding thing anymore. Forget it. I'm out. Well, wait a minute. There are some hormones involved here. You can't just cut cold turkey. You're going to have to wean baby off. So, um, yeah, you can't just stop one day and go, yep, that's it, I'm done. It's going to be easy for you to wean off. All right. So, we have to recognize as well that sort of the birthing parent as far as postpartum mood disorders go. And in your handouts, and I'll give you sort of the page for those in a second. In your handouts is all of this listed there, so you don't have to remember any of it. But I do encourage you to maybe pull that page out and put it up somewhere. But we also have to recognize that partners can potentially experience postpartum mood disorders as well. It just looks different for them. So for the partners, I get, the male partners in specifically, you're a manly man, you don't have feelings, you crush them down into your pocket and we're not going to talk about them. But that isn't helpful. So it's important that if you are struggling, if you this maybe wasn't quite what you figured it was going to be, it was more difficult than you thought it was going to be, this isn't quite what you signed up for, please make sure that you're talking about it. It's okay to not be okay, but it's important that you talk to somebody about it so that you can work these feelings out. And if it isn't going to be with a psychiatrist, a counselor, a psychologist, somebody like that, at least find a friend, a buddy, an uncle, a brother, somebody that you can have a beer with and just sit, especially somebody who's done it before, who's been through this before, and just have those open conversations and say, like, oh my God, like, this is what's happening. How did you handle it? But you have to talk to somebody. Okay. You can't just hide all this stuff away. We also know that male birthing parents in particular can experience post-traumatic stress symptoms just from attending the birth of their baby. So it's okay if you're not okay, right? It's kind of one of my favorite sayings. It's okay to not be okay.